prescribed medication order and communication skills. In this prescribed medication order, it is written order form which is given by the physician and dentist or nurse to the patient, and the health professional for the medication to be dispensed by a pharmacy for administration to a patient. What are the objectives of the prescribed medication order? Here, to identify the elements of prescription and reviewing the prescription, to find the difference between prescriptions and medication order, to identify the 6 steps which preparing and dispensing extemporaneous prescription, and to describe the prescription labeling requirements. This prescribed medication order is used, and it has some legal requirements to transport or to give the medication order. What are the legal requirements of the prescribed medication order means? Here some legal requirements of prescribed medication order are given. They are recent legislation and new technology, important good pharmacy practice, and handling of the material, interpreting, authorizing. These are the some legal requirements which need to be have a pharmacist, and it is equally important for the doctors and patients to understand their rights and obligations with regard to prescriptions. Doctors, in this prescribed medication order, the orders play a vital role, and they are accurately and write their prescriptions correctly, and they must keep records of their prescriptions on their patient profiles. We are already seen in hospitals also. If we go to the hospital, they will give the record or profile, like a record is given. In that record, our name, our gender, and everything will be filled in that record, and the medication also is placed in that record, and it must include the international classification of the disease and health related problems also given in that prescription form. And when we come to the patients, here the patients have a right to ask written prescription and have the right to dispense the pharmacy of their choice, and the patients have the right to retain the original prescription until the last repeat has been dispensed, and patients have a right or responsibility to supply the original prescription to the pharmacist and present to the original for the each repeat. Sorry, I didn't understood that point. Patients have responsibility to supply the original prescription to the pharmacist, and patients has right to be legally may not to be possession of any schedule 3 to 6 medicines if they do not have a legislate prescription for their medicine. They will consult the doctor. They must have to consult the doctor. Pharmacist and their assistants. Role of pharmacist and their assistants in the prescribed medication order. The pharmacist has obligation to verify the authenticity of the prescription, and the pharmacist must retain the prescriptions for the period of time, like 5 years, 10 years, likewise. and pharmacist must dispense the doctor's instructions. Pharmacist must endorse the prescription with the necessary changes made by the including repeats given notes of the configuration or communication with the prescriber. And pharmacist must have to write the patient to present the original prescription and to follow the verbal instructions with the written, written prescription. Here we already knows that in pharmaceutics we already study about the parts of prescription. The parts of prescription in this prescribed medication order, the parts of prescription is there. In these parts of prescription, prescriber information is placed and patient information is there. Date of prescription must be noted and superscription and it containing inscription, subscription, direction to the patient, that is called as transcription, and signature of the prescriber. I will show that. Okay, here you can observe clearly prescriber information, patient and patient name, date of the prescription, superscription, inscription, subscription, transcription, signature of the prescriber, and sometimes some prescription forms contain the signature of the doctor also. You can clearly notice here the prescription form will be like this, and here everything is there. Prescriber information is there and superscription is there, that is indicated by RX. Inscription, in the inscription the drugs will be noted and name of the starting name of the patient and date of the prescription, and finally signature of the doctor and prescriber also. In some cases patient signature also must be used in the several cases. And the prescriber information contain name, qualification, practice number, address of the prescriber. Patient information contains name, address, age, weight of the patient, and the name, address of the person to whom the medications are delivered in the case of prescription which is issued by the veterinarian. Third one is date of prescription. The date of issue of the prescription order will be must be noted, and superscription. This superscription which contains RX, it is denoted by the RX. This RX is abbreviation for the Latin word which is in Latin it means to take or take though. Latin word of the RX is recipe. The symbol of this RX is designated to the Jupiter, in which is called as the god of healing. And another one is inscription. In this inscription, it is the main part of the prescription. It contains the name and quantity of the prescribed ingredients. It also contains manner in which medication should be taken. Subscription. This part contains prescriber direction to the pharmacist, which include types of dosage forms and number of dosage forms. The information is noted in the subscription. Here one super, in super R is there. Okay. In super here RS is there. This RS is which is RX. And after that, transcription is the direction to the patient which contains instruction about the amount of drug and the time, duration, frequency of the drug. And after that, signature of the physician. The physician's signature is must to be handled. In this signature, address and registration number should be written in this signature of the physician. Handling of the prescription. After completion of the writing prescription, you must have to handle the prescription very carefully, and it is a more important. Handling of the prescription contain receiving, dosage calculation, compounding, finishing, pricing, delivering. These are the parts of the handling of prescription. In this handling of prescription, receiving the prescription contains pharmacist should himself receive the prescription. It includes reading the prescription, checking the prescription, and dose calculations will be there, and then compounding. In the dose calculations, it must contain Young's formula, Feed's formula is there. That is nothing but we already studied about in previous classes. Okay. And compounding means the ingredients are compounded by the accurate method for weighing. Electrical machines should be used. After compounding, the finishing of the prescription is there. It includes packaging, labeling, rechecking, recording, pricing. These processes must be noted in the finishing of the prescription. Interpretation of the prescribed medication order. In the interpretation of the prescribed medication order contains drug use is a complex process which contains many drugs related to the challenges at various levels, which involving prescriber, pharmacist, and patients. While medication misadvantages are occur anywhere in the healthcare system, from prescriber to dispenser, the administration, and finally to patient use, the simple truth is that many errors are preventable, and pharmacists assume the active role in the appropriate use of drugs.